The news of our second COVID-19 wave has been made all the more worrying with the news this past Friday that much of the new wave of infections is being driven by a mutated form of the virus. It's the 501 version 2 mutation. It's unique to South Africa, though somewhat similar to a mutant variant of COVID-19 in the United Kingdom. Now, that version of the virus is spreading quickly. It's led to international flight cancellations in the UK and stringent lockdowns. Let's discuss what our mutated version of COVID-19 means here. And I'm joined by Professor Adrian Puren of the National Institute of Communicable Diseases. Good evening, Prof. Always great to chat to you. So the UK has taken quite a drastic response to their mutant variant. Our version seems to be even more mutated than their version, though quite similar. Should we be taking as drastic action? Should we be closing our borders again, going into hard regional lockdowns?
Sandra, it's very difficult to answer that particular question. I think it's really, as you said, the variant is certainly a dominant strain in circulation. And again, I think we need to just be cautious about association versus causation. So there are still some really key questions that we need to ask ourselves and to really answer those. And I think that's where the focus needs to be. But I think the answer is that we still then have to come back to the fact that it's really about the reinforcement of all those particular controls and what nuanced approach we can take. So it's not simply about a severe lockdown, but really gauging what's happening in each particular setting in order to actually manage the actual epidemic.
Yeah, the briefing on Friday was clear that there's quite a lot that we still don't know. And one of the things that we don't know is whether the death rate is higher with this mutant version compared to the original, I suppose, that we saw in the earlier part of the year. When do you think we'll be able to gauge that?
Well, I think these are really difficult. I think there are going to be various studies to try and address, for example, mortality, to address the severity of clinical outcomes and presentations. I think the other key at the presentation is this affecting youth more prominently in terms of not having comorbidities, for example. So I think there are multiple key steps and key questions that need to be asked and really try to answer those as soon as we can. Unfortunately, some of these things do take a while and they're fairly complex. So, for example, if you want to compare clinical outcomes, you would perform what we call case-control studies. And again, those can be really complex to compare those that have the variant strain versus, or the variant lineage versus those that have other lineages, for example.
You're right, there are so many variables, but the issue of young people with no comorbidities getting critically ill, it was quite clearly linked, it seemed, at the beginning of the media briefing on Friday. Surely that's an easy one to assess, because we know that generally young people can often be asymptomatic and they can, by and large, not all the time, pass fairly easily through a COVID infection. Are we seeing more young people in our hospitals due to COVID-19 at the moment?
As far as I'm aware, when I look at some of the data that I've seen, I don't see that has been a major problem. But again, I think we will definitely look at that. What we did see, you're quite right, at the early, about a week or two ago, was certainly a spike in cases or positivity in the younger age group. So that was certainly evident, but that's no longer the case at all. So I think we really need to be cautious about how we interpret those types of data and make sure that we're clear what we're looking at and can answer the types of questions you're really keen to get answers to.
I suppose in a year of uncertainty, there's just more uncertainty that we have to be at peace with. I do want to speak to you about the progress of the second wave. Just looking at active cases in the past 24 hours, the Eastern Cape, which was once the biggest concern, is now fourth on the list of active cases at just over 13,000. Western Cape tops the list, just under 35,000 active cases, followed by KwaZulu-Natal and then Gauteng. How long do you think before the whole country is consumed with the second wave?
Well, it's really difficult to tell. Again, I think, when we had some of these discussions in the first surge, we really looked at testing rates, for example. So that's another important influencing factor. I do see the testing rates increasing, and that's important, but the positivity rate, however, still remains fairly high. So to get a full picture becomes very difficult. But we're certainly seeing so in the Eastern Cape, for example, you're quite right, we're seeing some levelling off or plateau. Again, is that because the testing rates are not sufficient for us to really get a good idea about what's happening, whereas in the Western Cape and in KwaZulu-Natal, the trajectories are fairly rapid. I think it becomes very difficult to model that, but it also comes back to the fact that what are these types of interventions that, in fact, can then, if you like, again, flatten the curve. So I think although modelers would like to get their hands on data of sufficient parameters to really get a sense of when that curve will be reached or that peak will be reached, I think it really becomes very difficult to do that type of modelling.
The DA has raised concerns about the Gauteng figures. Now, getting accurate figures is so crucial, as you say, to really getting a shape of where to put your resources. Are there concerns within the scientific community around the data coming out of Gauteng?
I'm not fully aware of what those considerations are, but I am aware that, in fact, the NICD is working very closely with Gauteng to really try and ensure that the public have the confidence in the data that is being released. So again, the data comes from different sources. Perhaps are there differences in terms of the data sources and reconciling that, or are there data lags, for example, that may explain some of these differences? So we're certainly keen, because we have seen those reports, to really make sure that the public has the confidence in the data that we are actually producing or that the Gauteng Department of Health is actually releasing.
All right. And just going back to the new variant, we know that what's the new variant in the UK is not exactly the same as our new variant. Does it give us clues, though? And if so, what does it suggest we might be heading into?
Yeah, so the key changes, I think, that are really critical are around what we call the receptive binding domain. So that's important in terms of answering questions around transmissibility. And so, again, there'll be really key questions around seeing what is the rate of spread by doing what we call ecological studies or even laboratory-based studies to see what extent the binding of that particular variant is versus other strains that are in circulation. And also, when we come back to the vaccine, perhaps as well, that's also going to be really critical to understand whether or not the neutralization of this virus is not going to be effective. That's going to be critical, as well as reinfection as well. Again, if this virus has changed or altered and can reinfect far more easily, those are the sort of types of problems that we are definitely going to be faced with. And I think, Sally, it comes back to the fact that at the moment, given that there are these unknowns that we need to answer very critically and in the shortest space of time as possible, some of this may not be in the shortest space of time that we need. So it comes back to all those MPIs and reinforcing the non-pharmaceutical interventions to really try and manage.
That's the best we've got. I want to ask you about the beach closures. The DA is arguing that there is no scientific evidence that closing beaches is a good idea. Are they right or wrong?
They could be both, in the sense that it depends on the various scenarios and how it is managed. Again, I know this is about outdoors, but you come back to the fact that large gatherings where you cannot control, where people are in close contact, not wearing face masks, in terms of the close contact as well, under those circumstances, those are the types of risks. And how do you manage those particular risks? Even though it's outdoors, I know we argue that being outdoors is better than indoors. But again, those are the types of things that you really need to manage. If you can't manage that and have large crowds, then I think you may well run into those types of problems. So if you can manage the processes, if you've got all the required staff to manage the beach and those numbers, then yes, you may be fine. But if you cannot, then you run into those risks. The super spreader events are the critical events that cause transmission in this particular epidemic. So those are the things that need to be considered.
Well, thank you very much for your time. We do appreciate it. That was Professor Adrian Puren of the National Institute of Communicable Disease.